This meeting is being recorded.
Welcome, welcome, welcome. This is Edna White. I am your host for Keeping It Real on Purpose, where you talk to real people about real things, about real life, all on purpose. And today, our guest is Firouz. I'm going to mess this name. I'm not going to mess it up. Daneshgari. Yep.
Daneshgari, very good.
Daneshgari. Yes.
Yes.
I'm getting better. My audience knows me as, because I have dyslexia, sometimes it's hard for me to kind of form the letters. And I see it, I hear you saying it. I'm not a great repeater of the language, I will say, of most languages. So I have to get it. So thank you for being here. I'm so excited that you're here. And I know you're an author, but I want to ask you a question. How do you show up in the world?
Oh wow, I'm a surgeon scientist. I was born in Iran, immigrated here with my family, raised in Chicago, where I completed my training at the Loyola University of Chicago. Then moved to Colorado with my newly wedded wife. We've been married for over 30 years, and
congratulations!
Thank you. In Colorado, and then that's where I completed my urology training, and then went to UT Southwestern, where I did my fellowship training in female urology. And out of that career, I came up with the concept of combining the field between urology and gynecology. That brought me back to Cleveland Clinic at Cleveland, where I started the very first fellowship program, where what is called now female pelvic medicine reconstructive surgery, a mouthful, but really taking care of women with female pelvic floor disorders. And I rose through the rank of academia very fast, became the chair of a couple of departments, the last one at Case Western Reserve University. So that is where I, because of the success of the program I was leading, they asked me to serve on the board of a health system. It was about 11 hospitals, hundreds of outpatient facilities, about $3 billion a year revenue. During that serving on the board, my eyes opened up to the fact that I work in a sick care system and not a healthcare system. So as my nature of being a scientist, I started investigating why we have become the most expensive healthcare in the world, why we have the best trained people, the best technology, but the healthcare has become so unaffordable. So I went to a business school and I spent 2 years studying the root causes of why the employers became the sponsor of healthcare for working Americans, why the Medicare was born, why we didn't choose the single payer system. And out of that, I came up with the conclusions that I've written in my book, recently published, called Health Guardianship, the remedy to the sick care system. So I would love to explain the concept, but I'm going to pause here and let you ask me questions.
So it's a mouthful, but I wanted to ask you, what do you mean by sick care system?
Sure. So what you read in the book, if you go back 120, 40 years ago, we didn't have anesthesia, we didn't have surgeries, we didn't have blood transfusion. So the life expectancy was in 50s and 60s. Women, about 20, 30% chance of dying during the childbirth. The children will die with infectious diseases and so forth. So the infectious diseases were number one cause of death. So after we discovered the bacteria and the germs and found out how we can prevent them, we started learning that the best way to prevent the infectious diseases is to provide clean water, clean food, vaccination. And within a couple of decades, we were able to eradicate the infectious disease as number one cause of death. Then we started realizing that the next one is cardiovascular disease, one is cancer, and so forth. So we started putting our efforts in finding out what causes heart attack, strokes, cancers. And out of that, we came up with lots of diagnostic and therapeutic tools. And we house them in the institutions called hospitals. Hospitals in the turn of the century were charity houses run by, religious organizations, charitable organizations, where you go down, lay there and kind of pray and have warm food and, warm bed until you declare yourself, alive or dead. But the hospitals started absorbing the surgeries, became the site of diagnosis, x-rays, and so forth. So what happened over the past 100 years, we have created institutions that we call them hospitals that have become the site for taking care of sick when we are sick. Although they call themselves healthcare system, but they don't really financially, the hospitals make money and benefit from it when we are sick, when they do procedures on us, when they make imaging and so forth. So that's why it's a misnomer that we call them the healthcare. It's really a sick care system. So they're there to take care of us when we are sick. And that is the terminology, I think, not only speaks to the true nature of the hospitals. So the healthcare, what we call healthcare in the US, are delivered through about 5,000 hospitals that are really institutions for sick care.
That makes so much sense.
Right.
I really embrace that sick care system. I really embrace that, because I think that really is what they are, and not for health.
So if I may follow up on that, over the past 100 years, the same time we discovered how we can make a diagnosis and so forth, we have gathered significant amount of scientific information on how we can prevent these diseases, how we can eradicate some of these diseases, very much like we did with infectious diseases. We know what the risk factors for obesity are, obesity being number one cause of some of the mortalities. We realized that during the COVID, there was a linear correlation between mortality from COVID and obesity. We know exactly what causes the diabetes. We know exactly what causes the cardiovascular disease. So we have more information about how to mitigate the risk and prevent those conditions than, frankly, we know how to treat them. However, the problem is, although we have the institutions to take care of sick care, we don't have any institutions who could basically help us to remain healthy and financially benefit from that. So we don't have institutions who at the age of 20, if I have two kids in the age of 20, start helping them to remain healthy, adopt lifestyle changes that would prevent them nearly 100% to become diabetic or obese when they're in their 40s and 50s. So the whole theme of my book and my new career is what I call the health guardianship. Very much like we built the public health at the turn of the past century, I believe with some changes, it's not a major change, we don't need the act of Congress. With some changes in the current system, we can create institutions that I call them health guardianship. Their job becomes to protect us from becoming sick. So very much like COVID, if you remember, during the COVID, public health was issuing orders and decrees that wear masks, have social distancing, do this and do that. That was, all of us did, right? And then if we got sick, in 2020, we knew we had to go to the hospital if we were sick enough. But if we were not sick and we wanted basically remain free from COVID, or even if we got the touch of COVID, we wanted to stay home and so forth. That is where I think the need are. At this point, the public health takes care of our clean food and water and vaccination. We have hospitals who would take care of us when we are sick. I propose that we need institutions who basically start helping us to remain healthy. by integrating the clinical science and other changes that we need to make, because biologically we know, or I know as a surgeon scientist, we all of us could live to age of 100 without chronic conditions. The reason we are, the reason we have ton of examples around the world, people who live to 100, right? Warren Buffett is 92. He's still running one of the wealthiest companies in the world.
He sure is.
His right hand, Charles Munger, he's 99 now, and they're running they're running the businesses and so forth. So, if we could do this correctly within this century, we would create a new segment in our healthcare. I call it Health Guardianship, that would help us to remain healthy.
Wonderful. That sounds exciting. I mean, I hope that you're on the cutting edge of putting this together and moving it forward, because that's something that we really do need. And I like the words health guardianship. I do.
Indeed, I am. Actually, after I reached to this conclusion that this is the way to go, or this is it is basically after 2 years of spending in the business school, I came up with these findings. A, we are the most expensive healthcare in the world. We are spending
Absolutely.
300 to 500% more than the rest of the world, the Europeans and Japanese. Absolutely. We are spending 11,000 per capita per person per year. Europeans and Japanese are spending 3,000 to 5,000 per person per year. Number two, the reason we are so expensive because so-called the healthcare is delivered through these 5,000 hospitals that are sick care really, and because of they generate what they do because they get paid for everything they do. They generate 50% of waste. Waste means the procedures, diagnostic, therapeutic, and so forth. They do it because they get paid for it, but doesn't help us to be healthy. It's like a mechanic that you take your car to. Because you have an insurance, because you're not paying out of pocket, they'll do, you take them for oil change, but also they end up changing the engine and the tires and which really you didn't need to begin with. The reason this waste continues to exist is because there are some systematic misalignments in the system. The three main systematic misalignments are over the past 20, 30 years, the hospitals have started employing the doctors. So if 100 years ago, if I was a doctor and you were my patient, I was a doctor, you were my patient with my hand. We both lived in the same neighborhood. We bought from the same grocery stores, from bakeries, the butchery. And I would see you and your family members, and when you come to me with some symptoms or illnesses, I would render my opinion and my expertise based on all that information I had. And I knew tomorrow morning, if I overdid it or if I charge you extra, tomorrow morning, I'm going to see you in the grocery store. And that relationship had existed. This relationship upon which the largest industry in the world has been built on now has been filled with 20 intermediaries, at least 20, insurance companies, hospitals, employers. And what has happened, the hospitals have started employing the doctors. And that is where kind of my aha moment came, because at the hospital where I was working, we had a financial projection for the year. We know how many surgeries we had to do. We needed how many procedures we do to make our margins. So my job as the chair of the department was to come and beat on my faculty, beat on my doctors to basically, rather than seeing 20, 30 patients a day, see 40, 50, 60 patients a day, because they needed to generate that volume. If they didn't do that, then I would lower their salary. So this single most important financial misalignment there is that the doctors now have become the agent of the hospitals, not the agent of the patient. Because when my faculty, when I started threatening my faculties lowering their salary tomorrow morning, when he or she would go to her office, what he would see out of you as the potential patient is How much more can I do on you to basically create clinical volume so my salary won't be cut?
Right.
So that is the first misalignment. The second misalignment is over the past 100 years, first the employers and then the federal government became what is known as the third-party payer. Let me give you an example. When you tomorrow, right after this podcast, you decide you're going to go and buy a TV, right? You go to a couple of stores. If you want to buy it, not buy it online, you compare the prices and the quality. You probably read some reviews and you choose. You're a consumer, but you control your money and you act as a customer. In healthcare, someone else on your behalf has decided what kind of coverage you could have, what kind of price they're going to pay on your side. That is called a third-party payer.
Gotcha.
So this third-party payer basically pays for that 50% waste out of your pocket.
Wow.
Because at the end of the day, if you're an employee and you're getting your health insurance through your employer, no one gives free money to your employer to provide you with health insurance. Your company has to make that money. And if that money is spent basically 50% extra for the waste of the hospitals, that is coming out of your pocket. That is coming out of your earnings. If you are employed and getting your insurance from your employer, and it's coming out of our tax dollars when we go to the Medicare. So that is the second misalignment. A third-party payer, government and the insurance companies, basically they pay for the waste of that sick care system out of your pockets or out of your tax dollars. So these are the details that I've explained in the book. And the solution is, as you said, as soon as I figured this out, I said, this could be fixed. We as Americans are very smart. As Churchill said, we do everything wrong until we find the right thing. And we do it. And I think the time has arrived for us, because frankly, the healthcare has reached to the point that neither the government or the private could afford it because it's so expensive. The cost of providing healthcare for an employee now in the US has reached to $30,000 for a family of four. The average cost of housing is half of that, almost $17,000.
Yep.
The average cost of food is about $6,000. It's 5 times more than the average cost of food, the healthcare. And the food is the most essential need we have. So what I did after I figured this out, I said, the best way in the US that the new ideas flourish and come up is when you go and form a startup company, right? Is over the past 40 years, companies like Apple, Google, Amazon, and so forth, they started in garages, right? The new ideas are born out of the entrepreneurs. And so from a surgeon scientist, I became an entrepreneur. I opened a company called Bowtie Medical. And to basically build up the health guardianship. So over the past few years, we have embarked on this whole journey of creating the model of health guardianship and selling it to the employers and their employees.
Wonderful. So how does that look to an employee?
Employer.
Like, your employer, how does that look to an employer?
Sure.
What are you offering?
So what we do is we come to your employer. Let's say you work for a company that has 100, 200 employees. Currently, the way your employer buys the health insurance for you is called a full insurance. They go to an insurance company and buy the full insurance. That is the most expensive they can do. We go to that company, we say, we are going to transfer you to a self-insured model. Self-insured meaning the employer is self-insuring itself. And so we partner with the employer in that self-insurance. We have a captive self-insurance. We provide a health guardianship that basically consists of a primary care 24/7. So you have access on your phone, on your tablet, on your mobile device, 24/7 to a group of doctors and nurses who are there to provide the care you need.
Oh, nice.
Whether the care is an
Mhm.
acute care, you have a sinus infection, earache,
Right,
or
right.
managing your blood pressure or your diabetes and so forth. And then if you need to go and see a specialist, we have access to a specialist. We make the second opinion because we want to
Mhm.
make sure we become your guardian, we become your Sherpa, if you will. We want to help you to navigate the complex maze of the sick care system to avoid that 50% waste and also get you the best price for the services you need. Currently, 5 miles from where I am standing now, if I want to get an MRI of my knee or my neck or whatever, if I go to a hospital, that would
Right.
charge me somewhere about $4,000. If I go to
Right.
an independent facility, I can pay as low as $300 to $400. But this outrage difference in prices are invisible to the consumer because, as I said,
Right. You see that.
so our team that is made of primary care doctors, nurses, advisors, we become
Mhm.
really your agent. We are 24/7 available to you to help you to get your care needs. And if you need a specialist or a procedure, we help you to find the best one for the best price. Out of this setup, we have shown that we can deliver 30, 40, 50% savings, meaning reducing the cost for your employer by 30, 40, 50%. And of course, the
Wow.
employer realizing those savings, they have a better chance of using those savings toward increasing your wages or giving more benefits and so forth. That's what we're doing.
That is impressive. Is that in your state where you are, or are you trying to expand around now?
We are focusing, I'm in Ohio, we are focusing in Ohio,
Okay.
but currently we have members in over 30 states. So
Okay.
depending on the size of the employer, we don't have any geographical limitations. Any employer could become our client.
Okay. So, what's the name of your book? Can you flash it for us real quick
Oh,
so we
sure.
can see it?
The book is called Health Guardianship,
Okay.
The Remedy to
Right.
the Sick Care System. Is
And
available
how
on
can they order that? How can they order?
is available on Amazon.
Okay.
You just type it Health Guardianship, or if you remember my name, Firouz Daneshgari, and Amazon will send it to you. It's available in soft cover, hardcover, and Audible, and also in Kindle.
Okay.
And
Oh, wonderful, Dr.
if it
Firouz.
makes you to help you, my son, who has a wonderful voice, has narrated the Audible one, so you can listen to it and enjoy his voice as well. He's a musician. So
Oh, nice. Okay. Very nice.
very nice.
That's very nice. Yes, yes. So now that you're doing this, how can employers contact you?
Our website is www.bowtie medical, like the bow tie. And I
Mm-hmm.
would explain to you why we named it as Bowtie, but the company is Bowtie Medical. I'm on LinkedIn. They can search me, Firouz Daneshgari, or my email is fdfrankdavid
Okay.
at bowtiemedical.com. They can contact me.
Wonderful.
So if you're interested in hearing why I called it a bow tie, are you?
Sure. I want to know this.
Okay. Now, is to begin with, because I wear bow ties. So that was the thing.
Oh, okay.
But the concept of the bow tie actually is more of a relates to the health guardianship.
Okay.
And that is the bow tie risk management is taught in the business schools. Let me actually bring your bow
Okay.
tie so I can show it to you. Hang on.
Okay.
So this is a bow tie, as you could see. There is
Okay.
a knot in the middle of the bow tie, right? And there is a wing on the right side and the wing on the left, right? So the concept is the knot in the middle is an event that may happen in the future.
Okay.
This event could be obesity, heart attack, cancer, any
Ooh,
medical
good.
issues, right?
That's good. Yeah.
Right. So the things we can do is we can basically work here on the right side as I'm looking at it to prevent that event from happening. Or we can wait for that event to happen and react to it. I'll give you an example. You can turn this event into fire. You can use it as a car crash or airline crash or chemical spill, right?
Right.
In healthcare, currently, that's why I call it a sick care, we wait for that event happen. We wait for the chest pain to come in, we wait for the diabetes to happen, then we go to doctor, and the doctors have plenty of pills and surgeries and injections and so forth, and that's why it's a sick care.
Right.
Whereas there are other industries that they say, no, occurrence of this event is unacceptable. The best example of it is airline. The very first flight happened less than 120 years ago. But in airline industry since then, in 1903, we decided that the airline crash is unacceptable, right? Because otherwise, no one would fly. So we put the entire effort of the airline industry on risk mitigation, preventing the airline crash.
Yeah.
And out of that, we have created the safest mode of transportation within 118 years. Now it is safer to fly with an airplane that is safer to drive with car or with animals. The animals and cars kill more people on the ground than the airlines that fly. Right?
Yeah.
So within 118 years, we have created the safest mode of transportation. The reason is we have put all of our efforts saying the airline crash by catching a fire at the 30,000 feet elevation is unacceptable. Therefore, the entire industry is pre-flight checklist and risk mitigations, right? The second successful example is the fire. When we came out of the caves as human and lived in the structures, we realized the fire is a risk. And therefore, we have embedded risk mitigation for fire prevention in our lives. All of us have smoke detectors. We teach our kids how to prevent fire, how to escape fire. And therefore, we have built skyscrapers like Sears Towers and Empire State that have stood there for decades without the risk of fire. Right?
Right.
Whereas in healthcare, we always have focused on left side of the bow tie. So we wait for the event to happen. It's like we wait for the cliff. You fall off the cliff, then we take you with an ambulance.
Yeah.
So my proposal is the time has arrived for us to focus the attention of the healthcare from the sick care part of the healthcare to the healthcare to prevent the risks for all the major chronic conditions that our population is suffering from. Obesity, diabetes, cardiovascular, because scientifically we know nearly all those conditions could be prevented. The only reason we haven't done it was because we don't have institutions, we don't have business models who could benefit from prevention. We do have business models who benefit from treating them, but we don't have a business model to benefit from. That's why I formed a company called Bowtie Medical to create the first model of this health guardianship.
That's good. That is really good. We thank you, Dr. Firouz, for being here today. It was really informative, and I learned something new. I really did. Well, I knew it, but I didn't know it, and you helped me and my audience know a bit more, much more about sick care system. I will never call it healthcare again.
Okay. Awesome.
And I know my audience really thanks you for being here. I thank you. And this brings us to the end of the show. We hope that The audience really loved it because I did. And I want you to like, subscribe, and share it around so that we can get all of this in front of the right people so that we can have a health guardianship that we all need. This is Edna White and my guest, Dr. Firouz, saying bye for now.
Thank you so much, Edna. I appreciate it.